we're so excited to be back here with the PMD Alliance and wHolistic. And, we started this as a journey sort of at the beginning of the pandemic, and here we are 2+ years later, have really sort of delved into some really interesting, topics in the world of Parkinson's disease. But I think I've been spending more of my time thinking about who has not been served well, and what my career to date has been lacking in terms of, my approach and sort of thinking about, sort of the world as a whole and what we can do better. And some people ask, well, I'm just a person living with Parkinson's in LA. Why do I care about the plight of Parkinson's patients in Africa or India or, many other places? Or why I'm a white man living in LA, getting served at UCLA by you. Why should I care about, women who are young in some of these places or in the UK? Well, I think that what we've learned, from our journey thus far is that largely we've been treating white affluent men who are married and understanding kind of, older white affluent men who are married and their disease course and what matters to them, tried treatments and really studied treatments in this population. And I think we've moved the needle somewhat in helping patients and specifically that demographic to do better. But when we don't serve a lot of these voices and hear about, the day-to-day struggles and also think about the genetics and the complexity of all the people on this planet living with this complex disease, I think that we then are not getting the full picture. And so really to move the needle for all of the patients and for all of us, living here who do this work, I think it's really important to expand our horizons and to include these global conversations. So through this journey, I've sort of dragged a few folks along with me. One is Dr. Kilbane here, Camilla, who's a friend who had approached me, I think 1.5 years ago and was like, I'm so excited about the series and want to try to give a talk, can you give me a topic? What could I do? Tell me what I can teach around, because I have many interests. And I was like, I just met this amazing woman, Omotola Thomas, yesterday, and she came on our series and talked about Africa and how in many countries in Africa, the basic medication levodopa is not available to patients. And she also taught me about how people who are diagnosed with Parkinson's, they're often hidden by their families, and that they're thought to have been possessed by a witch or something, and they're really not getting the care and not getting social engagement, and really, are sort of on the fringes of society in some of these places. And something about that conversation really struck me, and I talked to Camilla about this, had her watch the video. She put together an amazing presentation just of the global sort of impact of Parkinson's in the world, and has really been inspired by this work to connect with the ladies that are on today. I also, in my journey, met Tash, I guess is it Dr. Fothergill-Misbah, who we'll hear from as well, who joins us from the UK. She got inspired by some of these types of stories to get a master's and then a PhD, and has really done amazing research and advocacy work. And so we'll hear from each of these women, amazing women, and find out sort of updates on where we are and where we need to be, how to get sort of this work disseminated so that all the people living with Parkinson's on this planet are better served, and hence we can move the needle in research and really understanding how we can approach Parkinson's disease for each of us living, and doing this work, better. So first, maybe Camilla, I'll just have you say a couple words about sort of where you are, and you're going to be teaching us a little bit more about the updates from the slides that you gave us.
Yeah, so again, thank you so much for having me. It's really an honor to share the stage with my two co-speakers today. So so I'm going to give a little bit of an So again, I'm a movement disorder neurologist. I live and work in Cleveland. I do a lot of deep brain stimulation, medication management. And then just like Indu said, I became kind of inspired. I think, again, the pandemic caused different things for different people, but I think for me, it really made me, take a step back and kind of think about the world more, as a joint venture, and just kind of, look outside of ourselves. And also, I think as a physician, you want to make impact and help people. And I think, I was kind of thinking about how can I help people with Parkinson's, not just in my local community, but also globally. And so learning and doing these doing this talk, I learned a lot, and I was actually really shocked about some of the things I learned. And so it's kind of brought me to pursue some work that we'll talk about in a little bit, and collaborate with another organization as well. So I'm really excited to share the stage, and I will share some slides in a little bit.
Great. Well, Dr. Fothergill-Misbah, maybe you can teach us a little bit about who you are and what your inspiration is, and then we're going to pass it on to really the star of the show here, Omotola Thomas, to teach us about the amazing work that she's done.
Thanks, Indu. It's lovely to be here. I know we've been planning this for a few months now. Feels like forever, actually, and we finally got around to being here, which is really exciting. So currently, I am a lecturer in gerontology. What is that? So gerontologists study older people. So I'm specializing in aging in sub-Saharan Africa. That's kind of my niche. But before that, I did a lot of research on Parkinson's, as Indu said. I did my master's dissertation in Tanzania, and then my PhD research in Kenya. So since then, I've been involved with a lot of advocacy work, joined a lot of groups, applied for a lot of research grants, established a support group, which I'll talk about later. So just become as involved as possible, really, with the Parkinson's world, with a kind of global lens on it. So haven't actually done much to do with Parkinson's in the UK, despite being based here. But yeah, kind of championing for Parkinson's in sub-Saharan Africa and low and middle income countries in general. So I did some work for the WHO as well, which I'll talk about later, but I will pass on now to Omotola, and then we'll go from there.
So
thank you very much.
Omotola Thomas, she's an amazing Parkinson's advocate, mom, just woman living with Parkinson's, but so much more, really sort of inspiring much of all of us basically to try to do better. So Omotola, tell us a little bit about you and your updates. Really, the whole reason for this was to find out more about what you've been up to, which has just been this tireless fight. And it's really been magical to sort of follow. And I just I called you and was like, hey, tell me what's been going on. And we decided to do this show kind of around your work. So tell us.
I don't feel any pressure at all, Indu. Thanks. Thank you very much, Indu. I am honored to be here with Tash and Camilla as well. Hello, everyone. My name is Omotola Thomas. I got diagnosed with Parkinson's disease in 2016 at the age of 35. To cut a really long story short, when I got diagnosed, this was after 5 years of trying to figure out why my hands were shaking, why I was experiencing apathy, depression, anxiety, and all the other dozens of symptoms that come with Parkinson's. But when I got diagnosed, we had just moved to the UK. My husband and my 2 children, who were, I think, 9 and 7 at the time. And I remember feeling very isolated. I remember feeling very alone. Even though I was in the UK, we have great organizations, great Parkinson's charities that support people with Parkinson's. But I still felt very isolated because as an African, I didn't feel like my British counterparts who also have Parkinson's could relate to some of the struggles that I was experiencing. And I talk about them a lot. I talk about losing the ability to braid my hair or manage my daughter's Afro coily kinky hair. There are certain foods that require some type of level of dexterity. I lost that ability. And it was very difficult to find. It was not even difficult, it was impossible I didn't find anyone who I felt could relate to what I was going through. And so that was the inspiration for the establishment of Parkinson's Africa. It didn't start then, but I think 2 or 3 years after I got diagnosed, shortly after I got diagnosed, I did a lot of volunteer work with Parkinson's UK, different Parkinson's charities, and one thing led to another. And a year and a half ago, I established Parkinson's Africa. What is Parkinson's Africa? It's a registered charity that is committed and dedicated to empowering Africans impacted by Parkinson's disease. And we're trying to do this in a number of, before I go into why we're trying to do this, for me, I think one of the biggest inspirations was thinking about me being here in the UK, having access to support, to care, to medication, to whatever it is that I needed. I had access to it. And yet I was still struggling badly. I still felt isolated. I still felt alone. I mean, Parkinson's disease is anybody who has had any experience with it or has been affected by it understands that Parkinson's disease is very challenging on its own, under the best sets of circumstances. Now, when you add remove the layer of this best circumstances, you take away access to medication, access to support, access to educational and informational resources, and then you add on top of that the burden of stigma, you have a very complex, complicated, and challenging situation. So here I was living in the UK, having access to everything that I needed, but because I was born and raised in Nigeria, I lived there for 20 years before moving to the States. I understood that people who would have this condition who had the same condition as I did, I couldn't understand what life must be like for them. For those people who couldn't afford the basic medication to manage this disease, I wasn't even talking about going to the level of physiotherapy or occupational therapy, speech and language therapy, just basic levodopa. Many people in that part of the world cannot afford it. So this was also what drove me to establish Parkinson's Africa. So, and I said earlier, it's an organization established to support and empower Africans impacted by Parkinson's disease. And we're trying to do this in 4 ways, through 4 pillars. One is through advocacy. Another is through awareness and education, and I'll talk about a little bit of the work we've done there. Another is through support, and then the last is through improving access to medication. We have been established for a little bit over a year now, and I feel very fortunate with what we've been able to achieve in the relatively short period of time. We've had some very fantastic collaborations and partnerships. One of them was through the IPDGC. We got a grant to create educational leaflets and materials for Parkinson's disease. And we're able to do this in, I think, 12 different African languages. And by doing that, one of the things we're hoping to do is to break down the language barriers that exist and reach more people, so that to try to there's a lot of misunderstanding. There's a general lack of understanding about Parkinson's disease across many parts of Africa. So the hope is that the more we're able to distribute these booklets into people's hands, then the more people's knowledge about the disease is, the less the misconceptions and the less the associated stigma. So that's education. In terms of awareness, this past April was World Parkinson's Awareness Month. We sponsored, I think 3 or 4, I don't remember, I think about 4 different support groups, one in Uganda, Cameroon, Ghana, and Ethiopia. And I'll show you a video very shortly now to talk about, to show you what we did. And I think, what we're really trying to do is transform the landscape of Parkinson's disease across Africa into societies where those of us who are Africans and are affected by the disease have access to the resources, the healthcare, the information, education, and the support that is needed to live dignified and empowered and informed lives. I've talked about 2 of the 4 pillars. Advocacy was one, where we're trying to influence health policies, across, different countries, to get Parkinson's disease on the agenda of health leaders, to be able to influence those policies so that they're favorable for people with Parkinson's. So that advocacy, we've talked about awareness, support. I'll show you the support groups in the video. One of the support groups that we're working with is Parkinson's Support Group in Kenya, which was founded by the lovely Natasha, and she'll talk about that. And then the last one is access to medication. And that one is, I mentioned earlier why it's really important to me. Basically, like, even with access to everything that I need, I still struggle. So I believe that it's really, really important for everyone to have at least access to the basic medication that they need in order to be able to manage this disease. So I'm going to play a video real quick for you, if I can get my hands to stop shaking. Okay, here we go. Can you see my screen?
Yes.
Okay. One second, I'm going to stop that and then share it again, because I don't know if I enabled the sound. No, I did not. There we go. Okay. So the video you're about to watch is just a recap of, it's about 4.5 minutes long. It's a recap of all the activities we did this past April, and then I'll talk a little bit more about it now.
World Parkinson Day is commemorated every 11th April around the world. It is for this purpose that, as everywhere in the world, Cameroonian health associations decided to mark the event in their own way. This includes associations like International Parkinson and Movement Disorder Society, Parkinson's Africa, NeuroHub Training, Parkinson's 237 Support Group Cameroon.
I'm Dr. Vida Obese, the founder and the president of Indu Parkinson's Disease Foundation. It's a foundation set up to advocate for the needs of Parkinson's disease patients in Ghana. Our goal is to stimulate research into Parkinson's disease so that we can find a cure.
Greetings. We have a big organization called Parkinson's Africa, led by one of my sisters, Omotola, and she sends greetings to you all.
Parkinson's Foundation is founded to share the story of the final 10% of Adeomi Desalu's life. We thank Parkinson's Africa and all the connections that come with them for working with us and the energy you have brought to this mission.
For me, from the very beginning, my approach to dealing with Parkinson's has been one that I would call reckless optimism. And by reckless optimism, I just mean simply choosing hope above all else. Reckless optimism doesn't mean foolishly burying my head in the sand and denying the difficult realities that this illness presents. What it means is acknowledging those harsh realities and, in spite of that, still making a conscious decision to choose faith over fear, power over pain, and hope over horror.
Wow.
Thank you.
Really,
I'll just say one or two things real quick. I think representation matters, and I think these are scenes and imagery that has been missing from the Parkinson's community for way too long, for too many years. And I feel really honored to be in a position to have this organization that hopefully can serve as a platform to continue to showcase and highlight the work that these incredible people are doing, the people who are actually physically on the ground, helping these patients, supporting them. And so that's what I want. I'm hoping that Parkinson's Africa can be a platform to either identify these groups, or if, so for example, Guy is going throughout Africa, and I'm speaking to him almost daily, if not a few times a day. If he has a new contact, I spoke to him today, he got a contact in Cote d'Ivoire. They don't have any Parkinson's support group there. So we're working together to see how we can create that. So, just basically either establishing or highlighting the work of already established organizations. I think that was it.
amazing. I wanted to say a couple things. So one is reckless optimism, beautiful. I think we're with you. Hope, power, all of those things. I forget what the third word was, but choosing those, we're with you with those too. So, here I think we've collected some of your fan club, and we're here to help you in any way we can. It's really inspiring, and honestly, I get kind of emotional just realizing how much you've done in the last year to move this needle. So anyway, sorry. So I think a few things just from my piece. One is we've been doing work on women and trying to increase sort of awareness of the plight of women across the world. And so you add on the layer of being a woman and the head of, many domestic duties in the house and trying to care for all the people through adversity in the COVID climate, along with all the other things that you talked about, in these countries. It was just pretty stunning, because not only do people have to fight even to get the right diagnosis as you did for years sometimes, and be told that, their symptoms aren't real and that they can't get Parkinson's because of the way they look. So we do have to change the picture, rebrand the image, really get sort of everyone to realize that somebody who looks like any of us could have Parkinson's, really. So that's one thing. From the movement to sort of society perspective, I think we're trying to chip away. Camilla and I are actually both on the membership committee. I'm the co-chair. And so I'm just so heartened by all the people who are joining the call from Africa today. It's just amazing. Welcome, and so excited that you could join us. So we are trying, as part of the membership committee, for any providers that are working and doing this work in Africa and throughout the world, we can offer, no cost memberships just to bring you into the society to be part of, amassing more information and education and empowerment, so we can work together. And we're realizing that a lot of Africa is served actually not by movement neurologists. There's really very few in the entire, honestly, continent, right? But, you know, we have physical therapists that are doing work on the ground, social workers, nurses, occupational therapists. I think these allied health professionals, really we're trying to appeal to you to come and join us through the Movement Disorder Society and join, you know, sort of the sort of numbers so that we can have representation. As Omotola said, Dr. Okudzejo is, you know, heading this African, I think, subsection. But we need voices, and we need members from these countries, and can offer it with no cost. And then you can get access to sort of the resources that are on there. And we want to be serving Africa better. And there's a lot of clinicians worldwide that want to provide resources. So we can only do that if we can kind of get these to you. So please join. So I think, you know, without further ado, again, amazing work, Omotola, just thinking about how much you've done just in such a short time, really just brilliant. And seeing those voices and the faces and the colors and the music, and just brings a lot of joy, but also this amazing sort of sense of, you know, a lot of voices that are not being heard. So we're really here to help with that. So Camilla, I think you had some slides to share, and then we'll get also into some of Tasha's work with sort of what the support groups sort of on the ground are doing as well.
Yes, so thank you. It's a tough act to follow, but I will try my best. And then I think, you know, I'm going to kind of take the leads of the slide presentation, but I'm going to have Tash and, you know, Omotola also kind of come in and comment as well when they have, you know, things they want to add. Again, I think it's important to just kind of think about access to healthcare. And I think we all can agree that access to healthcare is a basic human right. And so both the United Nations and WHO have come up with really, what does it mean? So what does access to healthcare mean? It means having medicines continuously available and affordable at public and private health facilities, or through a pharmacy or medicine outlet that is within 1 hour walk from your home. And then the WHO says that universal healthcare means that you give all people access to healthcare and services that they need, when and as they need them, without imposing financial hardship upon them. So these are kind of, you know, I think just the two kind of terms we should think about when we go through these slides and as we continue this discussion, because clearly we are not there for Parkinson's disease and for many other illnesses as well, of course. So again, as the physician, I get the kind of boring statistics part, but just to kind of go over some statistics. So in both high income and low income countries, neuropsychiatric conditions, which include Parkinson's disease, Alzheimer's disease, and then psychiatric conditions like depression, psychosis, things like that, really account for almost 40% of healthy life lost due to disability. So in all countries across the world, it is a huge drain of, you know, healthy lives lost, or years lost. And so Parkinson's disease is the most rapidly expanding neurological disease in the world. It's the second most common after Alzheimer's disease. And as you see from the numbers down here, the number of people globally affected with Parkinson's disease is increasing significantly. So in 2016, there were 6.1 million people living with Parkinson's in the world. And in 2040, it's projected that that number will double. So that's within 24 years, basically. And so why is that? So the increase in prevalence, which means how many people live with the disease at any one period of time, it's probably multifactorial, but amongst the factors that are responsible for this is that the population is living longer and there's an increasing life expectancy. Industrialization and exposure to factors like pesticides, for example, are known risk factors for Parkinson's disease, and have obviously increased in use. I think there's better awareness and better treatment. So people are getting diagnosed sooner and better, even though there's a long way to go. And then obviously there's improved research methodologies also that lead to more people being captured. But so So in the world now, 1% of people over the age of 60 will be diagnosed with Parkinson's and 4% over the age of 80. But it's estimated that 50% of people with Parkinson's in the world are not getting diagnosed and therefore not treated. So 1 in 2 people who have Parkinson's disease does not have a diagnosis and does not have treatment. So significant amount of work that needs to be done. So this is just, again, we're not going to spend a lot of time on this, but this is just a map of the world, obviously showing the prevalence of Parkinson's disease. And as you can see here, North America, Canada, and the United States have kind of the hotter colors, red and orange. So that means that they have a higher prevalence of Parkinson's disease. And then you look here, for example, at Africa, and you see that it's very dark blue, so meaning that the prevalence is low. Well, I think, at some point in time, physicians might have thought, oh, there's something there that means that people have less Parkinson's disease, but ultimately that's probably not at all the case. It's just that we haven't done the proper research there yet, or we haven't had, so there's a lot of work to be done. And so this is probably not an accurate, map of the world and the true incidence of prevalence of Parkinson's disease in various global regions. So I like to take my hometown as a good example, just to highlight the difference in access to care. So I live in Cleveland. There's about 2 million people in the greater Cleveland area, and there are over 20 movement disorder trained neurologists. So movement disorder specific, Parkinson's disease specifically trained neurologists, in addition to multiple nurse practitioners, physical therapists with special, focus on Parkinson's disease. And then let's contrast to some countries in sub-Saharan Africa. There are 6 neurologists for a population of 60 million people in Tanzania. And in Kenya, there are 20 neurologists for a population of 55 million. And Tash, if any of those in Kenya have movement disorder specialty training?
I don't believe so. I mean, a couple of them have had training in Parkinson's from high-income countries and kind of taken that knowledge back, but they are general neurologists, and so they'll see a range of patients, and often that kind of takes up a lot of their time that is not then spent on Parkinson's. And I might add, they are all located in cities. So these 20 are located in 3 major cities across the country.
So that brings up the next slide. And that is, I think, is something that we see in the United States too. There's a huge difference in access to care if you live in an urban area versus a rural area. And I think that goes for several states in the United States also, but it's even more heightened, more relevant in Africa. So this is a study from Cameroon. And basically in this study, they were trying to look at how many people were diagnosed with a movement disorder at a rural versus an urban center. And actually no patients were diagnosed in the rural outpatient center versus they were all exclusively diagnosed in urban centers, probably again because of different access and different training and not having access to neurologists, for example. So Omotola spoke about medications. So the WHO Neurology Atlas had an update in 2017, and they found that drugs for Parkinson's were available for 3% of those who needed them in primary care in Africa, in contrast to 70% in Europe and global average of 34%. And what are the medications that they list as essential? So that's levodopa or carbidopa-levodopa, Sinemet, or anticholinergic. So you might have heard of like Artane or trihexyphenidyl. Sometimes it's other anticholinergics. And also to note that the levodopa that is available is often not the one that we're used to seeing in the United States, the 25/100. It's either the 10/100 or the 25/250. And often a month's supply of these essential medication can cost more than a combined household income. So this is a study from Kenya, and I'm going to let Tash kind of jump in and comment after I presented it. So this is basically a study of 48 pharmacies that are in 8 regions of Kenya. There were 6 pharmacies from each region, and they found that levodopa was only available in 50% of the pharmacies and only 1 of the public pharmacies. And so some of the dopamine agonists and anticholinergic were much more readily available. But again, the dopamine agonists that they have available are not typically the ones that we would use more commonly in the United States. They're older medications like bromocriptine, for example. And the average cost of 100 levodopa tablet was $48, which is a lot. So Tasha, I don't know if you want to comment anything on this since you've worked in Kenya.
Yeah, I mean, this is a really kind of novel study, and it just proved how inaccessible medication was for Parkinson's, really. And it was a good representation of kind of urban and rural areas, public-private facilities, and the costs of levodopa go up to almost $100 a month, just for kind of basic, maybe 2-3 times a day medication. And if you think about the kind of average income of a household in somewhere like Kenya, it's just completely unaffordable. And then you have your transport to your consultations, you have your consultation fees at clinics, you have kind of other things, food, your kids to send to school, whatever it might be. So just this really demonstrated just the challenges that we have ahead of us in terms of making medication accessible and affordable for people.
So some countries in Africa and also in South America have started using mucuna pruriens. So it's actually a levodopa containing crop. There are also some patients in the United States who get this supplement. It is being studied in Tanzania, and it's also been used in Bolivia and Ghana as an add-on monotherapy because it is more cheaper. And then you can also use local premises like hospitals, or you even use, the coffee industry to ground these this crop.
Camilla, can I just add with mucuna, we've actually just received some money to do a pilot study on mucuna in Tanzania. So we're going to be developing locally sourced mucuna, kind of using local factories to prepare it, and then hopefully do another trial in Tanzania to understand the effect and whether it is a viable option for people with Parkinson's. So stay tuned for more research on that.
Excellent. And so, as you all know, Parkinson's disease care, it's not just about the neurologist, right? It's a multidisciplinary team care. It's the optimal way. So including the patient, the neurologist, the physical therapist, occupational therapist, all these different allied health professionals. And so the Movement Disorder Society is launching a program called Train the Trainer, which focuses on training and educating allied health professionals within the Movement Disorder African section. So that's, again, trying to move the needle and improve access to education and training, not just for neurologists, but for other healthcare providers and professionals. Okay. And so, and then again, we're meeting virtually, and I think our world has changed. We live in a virtual world now. Maybe the silver lining of the pandemic is that we all know how to do this a little bit easier. Again, we get to connect. I would have probably not been able to have a meeting with all you today had it not been for, this increasing connectedness. And so I do think it's made it easier to collaborate across the globe. I think it's become easier to have access for conferences, virtual support groups and patient advocacies, and also access to information for people with Parkinson's disease across the world. Because again, even though, I was just looking at where all the participants today came from, and it was Africa, it was London, it was all parts of Canada, the United States. So I think this is a wonderful thing that's happened over the last 2 years, and will help improve education and access to information. And so again, just as an example, the Movement Disorder Society, that's our big society for Parkinson's and movement disorders, international society. Again, they've been virtual for the last 2 years. It's going back to in-person this year, but I think, it's kind of amazing when you look at the number of participants. So, the last in-person conference was in Nice in France, and there was about 4,000 to 5,000 participants. Well, the virtual Congress last year had almost 20,000 participants. So again, I think that's a wonderful thing. That's 15,000 more people who are getting education about Parkinson's disease. And so hopefully, even though fingers crossed, we're going back to a more normal world in that regard, that this is something we'll keep so that we can, improve access to education. I also wanted to mention, again, since there are so few neurologists in many parts of sub-Saharan Africa, the Movement Disorder Society is also launching some training for general practitioners. presented in English in France for the African section of the Movement Disorder Society. So again, that will help make it easier for more patients to be diagnosed appropriately in a timely fashion. Again, telehealth or teleeducation had started a little before the pandemic, but certainly everybody's more used to it now. And these are just some examples of some virtual educational programs, both for healthcare providers and also for medical students that have shown very good outcomes. So I'm going to let Tash take the lead on this recently published, I guess it's not even on print, off print almost, but I'm going to let you take the lead on this.
Sure, thank you. So a little bit of context and background about this publication. So in April 2021, a group of experts in the field of Parkinson's disease across the world got together, invited by the World Health Organization, for a consultation on Parkinson's disease, which was actually the first ever of its kind ever, which was pretty fascinating and really inspiring to get together with all these experts. And we basically discussed at this meeting kind of avenues for where we can make change and have impact across the world in kind of a public health lens context. So off the back of this consultation meeting, I was working with the WHO and we developed a technical brief, which is due for publication soon. And in combination with that, we kind of worked together to develop this paper. So this is a journal article paper that is currently pre-print. So it's available online in kind of a need to get this out kind of status before it's peer reviewed. But the paper basically addresses 6 workable avenues for action within these domains. And this basically says to member states across the world, this is where you need to focus. It tells member states, so that's countries who are part of the WHO, which is the world, that Parkinson's is an issue, and it's an issue that requires attention immediately. And this attention is across these six areas. So first of all, we need to understand disease burden better. So we need to know what the epidemiology of Parkinson's is across the world, not just what it is in the US, although that I'm not so certain we actually know what it is in the US either. But that's a kind of priority, because if you have burden, if you have numbers, you can prove that it's an issue. Currently, if Omotola goes to a government in Nigeria, for example, and says you need to focus on Parkinson's, they'll go, well, what are the numbers? How many people are affected? How many are dying? And we can't actually answer that. So it's a huge problem that we need to understand burden and prevalence before we can kind of move on with other things. Secondly, advocacy and awareness, and Omotola has kind of shown that great example of what's going on already in Africa and also around the world. So all the support groups and PD Avengers and all these things that are going on across the world are really pushing for that second one. Thirdly, prevention and risk reduction. So Camilla mentioned at the beginning those kind of risk factors for Parkinson's, aging, the biggest risk factor, but those industrial exposures, etc. So what are the kind of impacts of pesticides and industrial solvents and things like that, and how can we reduce that risk? The kind of primary goal of public health is to reduce risk and kind of prevent the onset. So how can we do that? We need more research on it and understand what's causing Parkinson's. Fourthly, diagnosis, treatment and care. We've kind of touched on the medication aspect already. So we need to make sure that people are diagnosed accurately and timely, that they get treatment when they need it, and they are not therefore succumb to financial devastation, really, and that they can access the kind of holistic range of care that somebody with Parkinson's should have. So not just seeing a neurologist once every year and going home and that's it. What can you have in between those visits, and what support and exercises and all those kind of things can you have access to help yourself? Fifth, carer support. So the important role of carers in the role of the Parkinson's world. And we don't want to forget that caregivers play a huge role in kind of life with Parkinson's. So making sure that they are supported and that they get the resources and the education that they need as well. Last but not least, research. Obviously, as a researcher, I'm a big advocate for this one, and it kind of links in with all of them, to be honest. Across all of those different 5 categories, research kind of brings it all together. And if we don't have that research evidence, then we don't have the kind of tools and the evidence that we need to push forwards with all those other things. So that was a whistle-stop tour of kind of public health priorities for Parkinson's, which is really exciting because this is the first time that the WHO have said Parkinson's is a problem and it's an issue that we need to fight against. So I think if anything from this is that it's exciting that it's obviously Parkinson's is not exciting, but it's exciting that it's become an issue worth fighting for in the eyes of the WHO. So yeah.
Yeah, excellent. So it shows quite a lot of work has been done over the last, since the last time we met, right? Which is kind of exciting. So I did want to mention, apart from Parkinson's Africa, Omotola's wonderful organization, doing my research, I also came across this organization, and I thought I would just mention it because I think it's a unique organization, and I think they work pretty closely with you too, Omotola. And so this is a Canadian nonprofit that, their sole aim is to provide free medication, education, and walking devices for patients with Parkinson's in the world. And so far they've distributed 50,000 copies of educational programs. More than 5,000 patients have received free medications. They have, provided medication walking devices to 39 countries globally. And so I think, I just wanted to mention them because I've been working a little bit with them. And I think that this is obviously, as if we want to improve access, obviously this is a major factor. So I wanted to end with kind of touching a little bit to what Indu said in the beginning about the fact that we are all in this together. And I think that whatever moves care forward in one area of the world is going to move care forward everywhere. And so this is just a schematic about, taken from a paper about Parkinson's disease in Asia. But I think you could, basically take any part of the world, right? And I think we can learn so many different things from studying and helping people across different parts of the world. Number one, genetic studies, obviously. There might be some genes that can help us unlock mechanism and potential treatment options in the future that we haven't discovered yet because we haven't been looking. There's a big genetic study now in Latin America called Large PD, for example. There are also big genetic studies going on in Africa. And so I think, learning more about different people with Parkinson's disease is going to help us unlock and move the needle further towards a cure. And then also, obviously, we're humans and we interact for our environment and we do different things. So we are exposed to different solvents or different environmental exposures in different parts of the world. We might take part of, different type of lifestyle. So exercise, smoking, socioeconomic factors, other medical comorbidities may also play into, our risk of Parkinson's disease. And so I think I want to end it at that, and that this is, something that we're all in this together, and we can hopefully move the needle forward if we take a more global perspective on treatment of Parkinson's disease.
That's amazing, really awesome. Great to see how much has actually been done in the last honestly, year and a half by all three of you ladies. And, I think we sometimes look at these global pictures and the state of the world and global warming, and it's just like overwhelming. And, a lot of the political climate in the United States right now is very stressful for many of us. And you sort of get hopeless, but the sort of sense of, the reckless optimism and sort of finding these small low-hanging fruit to sort of chip away at, and just, so I think from a practical level, I do see this moving forward. I think that there are changes being made. I think the world is ready to have these conversations, and with, the technology, we can all work together. I think, Camilla in Ohio and Tash in the UK, and the work that Omotola is doing and communicating with somebody amazing who's going from country to country across Africa to increase awareness, and able to connect with them every day. There are, though, those that are not being served because of this digital divide as well. And I think we have to remember that when we're doing this work and creating these resources. And you saw those, the sort of booklets that Omotola has been honestly printing and handing out on the ground. So I think we have to sort of keep that sort of, as we're progressing so amazingly with this sort of advent of technology, we also have to remember who's not being served in these rural places where they don't have, access. Additionally, I was just looking up, the cost here in the United States for, 90 Sitimet, carbidopa-levodopa is $10 a month. So why is it, not like 10 times that in Africa? And I learned also that you can't even prescribe it. Even if you had the resources to get it, you would be able to get it in some countries. So there's really some things that we're really not understanding from these conversations, and things that are missing, maybe political or otherwise. So we have to kind of delve a little bit more into some of these things. But I think, so what are some practical, I think we have about 8 minutes left here, and I just want to leave the group with really a sense of, what can we do on a practical level to do. There's some people putting some things into the chat here as well. I see.
Can I just comment one thing when we talk? I think a lot of the time also the costs, I think I've looked up some studies for costs for the carbidopa-levodopa in parts of, Nepal or, different parts of the world. I think ultimately a lot of it has to do with the fact that it's not being produced on the ground there, right? And so it's all the transportation and this and that. And so I think ultimately to really make a huge impact, there would have to be a plant, right?
The other thing is that it's either imported or it's not registered. So that's the problem that we have in a lot of places in Africa, is that even though it's listed as an essential medicine in the country, it's not actually registered as a drug in the country, and therefore you don't import it kind of under a license and regulate it. It all comes in through parallel importation is what it's called. So unregulated prices and imports kind of based on need. There is no need apparently. Therefore it's kind of doesn't come in consistent amounts. So that needs to change in terms of registering it with the medications boards and governments, and getting pharma companies really to see it as a problem in those countries, because at the end of the day it's money making. Am I allowed to say that on here? But if there is no business model, there's no demand, why are they going to bother their time? And so again, going back to that burden and prevalence and making sure that people know that it is a problem, that would help a lot.
And the last thing I'll just tack onto that is, because it's not produced in the country, it's also susceptible to exchange rate fluctuations, so on top of all the other things, transportation, getting it, shipping and all that stuff.
So we have to find a way to get this to be made there, it sounds like. So somebody asked here, does the Movement Disorder Society do rotations abroad for trainees and med students? There has been, I think, folks that have gone to these countries and given lectures on the ground. We've had, through some private donors and stuff at UCLA, some folks, trainees come over from South Africa, I think specifically, and train with us and go back. And so they were at the medical student and resident level. So I think there's sort of some pockets of this work being done, but not enough. And I think, it's probably unlikely that we're going to train movement disorder neurologists for all the patients there. So we really have to, I think about, in some of the work that I've been talking about, is like really how at the community level can we affect change to get, sort of the knowledge and honestly the public service sort of announcements of, this is a common problem. A lot of people have it. Everyone can get it. It's not your fault. We need to sort of get that grassroots level knowledge there so people can come forward who have it, so that we can count the numbers and then start giving, honestly, education at the community rural level through the sort of work that you're doing. But I think stigma is a huge part of this problem. So just, building that disease awareness through whatever channels we have, be it, I know in India, with sometimes we're sort of advertising public service stuff in movie theaters before the movie is shown, and sometimes embedding it into a storyline of a movie, a Bollywood movie, but we have to sort of really think outside the box, and even in our own community. I just gave a talk for an amazing African-American group, and the sense is literally a myth of that Black people don't get Parkinson's disease. This was like the first thing that came out of somebody's mouth. Is I was so shocked that Black people got Parkinson's disease. So how is it in 2022 that people still think this is amazing to me? So we have to not just, get this awareness to increase in Africa, but even in our own backyards here in California and throughout the world. So working together. So I think, again, if we could just list, I think, the resources with this, I think it would be great. But so maybe I'll give you each ladies, a final word, what one or two of your most practical resources and tips maybe as to what the group can do. And then I think, you know, a lot of exciting things on the horizon, I know, from all of you. And so I can't wait for, you know, doing a follow-up maybe in 6 months or a year to hear the progress and maybe also how people can get involved with the cause. So maybe I'll start with Tash maybe, and then Camilla, and we'll end with our star of the show.
Thanks. Yeah, I mean, in terms of what you all can do, just by being here, it's great to know that you're interested in this topic and you're keen to learn and keen to, someone's just saying donate. That's definitely a route, and Omotola will probably tell you more about that. But I think just get involved if you're a local support groups. We've tried to think about having kind of buddy groups, so getting support groups in the UK kind of buddied up with a group in Kenya, for example, and kind of sharing resources and building those networks. So if you're part of a support group, then that's definitely an option. Get involved with things like PD Avengers, you know, those global kind of advocacy platforms. We're involved in some groups to improve global relationships and get medication on time and things like that. So I think advocacy and just share your stories and reach out to people and build those networks. Yeah, it's time now to do it, I think, in terms of this virtual world that we're living in. So yeah.
Great. Okay, Camilla?
So I don't know that I have a lot to add on to what Tash just said, but I think exactly, get involved. I think, I think that often, you know, contributing and helping others makes us feel better too. So it's not just about doing something. I think it's people thrive on being in groups and people thrive on helping other people. And so I think that this is another way to get involved, right? And to help the global, help other people with Parkinson's. I think the buddy support group thing is actually really awesome. That's a great idea. And so again, donate, obviously. Omotola has a wonderful nonprofits that you could donate to if you're interested in doing that. But I think, yeah, get involved. I think it's good for the soul. I think it's good for everybody.
And Omotola.
Again, no pressure, Indu. In terms of how you can help, I think Tash and Camilla have covered quite a bit. For Parkinson's Africa, our website is www.parkinsonsafrica.com. You just go on there and you see a big fat donate button to the right of the page. Feel very free to use it, or you can send me an email. Thank you, Kelly. She's fast. Kelly just dropped it in the chat box. Then there's so many ways you can help. You know, you can call, you can reach out to me. We're looking for volunteers. We're lacking manpower in many areas in terms of fundraising, people with fundraising experience, people with marketing experience, social media. I could do with a volunteer to help manage my social media. And then, if you have, like in the private chat, a couple people have sent me some very useful contacts. If you have contacts or connections, people who are looking to do, corporate social responsibility, there's so many ways that you can help. What I want to leave us with, and I haven't thought this through, so if I ramble, just bear with me. I have Parkinson, so I'm allowed to do that. I want to talk to us as individuals, because we've covered how you can help, and whatnot. I believe that most of us who are on this call are connected to Parkinson's in one way or the other. And for me, what I've found on my journey is that there is opportunity in adversity and there is power in pain. And I just want to leave whoever is going through one issue or another with those words. I am generally a glass half full type of person. And I found that, having that positive mindset has propelled me. I don't know how to describe it, but having a positive mindset has been hugely beneficial on my journey. So I just wanted to leave you guys with that quote, with those words. There's opportunity in adversity and there is power in pain. There's opportunity to inspire other people, to help other people, to look beyond yourself. And I think Camilla said, something about thriving in helping others. And I am a testament to that. I have done this work for 2 years on a full-time volunteer basis. And I have no regrets. I'm fortunate enough that I can do that. But it fulfills me in ways that I would never be able to properly articulate, particularly with an illness that has mental health issues like anxiety and depression. I don't take meds for that. I would like to believe that this is my antidepressant. Thank you.
Yeah, so thank you so much, ladies, for joining us. I would just leave with a couple of words. Exercise is medicine, and advocacy and this empowerment and volunteerism is hugely like medicine as well. So I think the connection that we have on this planet with each other is, it's a very basic connection that we have as human beings. So get connected. You are not alone if you're living with Parkinson's disease, and find ways that you can affect change, even if they're super small. And one, little drop in the ocean can actually, together we can really make a difference. So I think we can, sort of continue to have that reckless optimism that Omotola spoke about. So I'll leave you with that reckless optimism. Thank you so much, PMD Alliance, for hosting this, and we'll be back with updates because these ladies are making a difference. Thank you.
Thank you.
Thank you, everyone. Thank you for joining. Thank you for your questions and your comments. Sending lots of love into the universe. Thanks so much.